everybody. Welcome to Lady Vibe, your podcast for better well being. This is your co host, Dr. Ning.
And I'm your co host, Rachel. Thank you so much for joining us today.
Many of you may have heard about urinary tract infections, but you may not know that it's actually one of the most common health issues among women. Yet they are often brushed off as minor inconvenience or something we just deal with, right? But the reality is that UTIs can have a significant impact on daily life, from discomfort or disruption to more serious complications if left untreated.
So, in this episode of Lady Vibe, we're going to dive into everything that women need to know about UTIs, urinary tract infections, why they happen, why they're so much more common in women, and what your body might be trying to tell you. We'll talk about the symptoms, the real symptoms, including the ones people don't always mention, common risk factors, and when a simple infection can turn into something way more serious.
Yeah, whether you have had one episode of UTI before or you're dealing with recurrent UTI or you have not gotten one but you want to know how to prevent, this episode is for you. We're here to educate, empower and help you take control of your health with confidence. So, um yeah, so what is UTI?
What is a UTI? So, a UTI is an infection that occurs when bacteria, that is most commonly from the digestive tract, enters and multiplies in the urinary system. It can affect different areas, including the bladder, which is actually the most common, the urethra, as well as the kidneys.
Yeah, so it it can affect every organ along the urethra, your urinary tract. So
Uh-huh.
when it gets to bladder and kidney, it can have better. It will have a greater chance to turn into like complicated uh, UTI or more severe form of UTI. So um, like some of the like we have talked about prevention, disease prevention since the beginning of this podcast, right? For UTI, early diagnosis and early treatment is of great importance. Um, Otherwise, when it gets to this, systemic infection or like sepsis, it will be too late.
Mhm.
Um, so, what are the most common symptoms of UTI?
The most common symptoms. We all know that feeling when it's burning when we pee. It's kind of terrible. We have cloudy, dark smelling urine. We can have pelvic pain, especially as women. And then it's kind of like we feel like we can't empty our bladder. So even when we keep going to the bathroom to pee, it feels like we constantly need to pee. And then some of the more serious signs can include fever, back or side pain, as well as nausea or vomiting.
Like any type of infections, right? So if you notice any of these symptoms, um, when you in your daily life, like you have to take it seriously. Go see a doctor right away and get antibiotics. Usually the antibiotics can take care of the problem, but you may feel better after 2 3 days, but you still need to finish the course of treatment so that you don't develop drug resistance um,
Mm,
for the antibiotic, and especially for those who have recurrent UTIs, like you have to it's they are more likely to develop like drug resistance to
okay.
antibiotics. So finish the course, and then get complete clearance, um, each for each infection.
So why are UTIs more common in women? I just hear a lot of my friends talking about getting them. I know I've had them a couple of times, especially in my 20s from I believe I've gotten it from wiping the wrong way. But what is it that makes women more at risk for developing UTI?
Right, it's like one of those things that it has to do with how we're built, right? Our anatomy, like if you know the anatomy of women, like the urethra opening is very close to the vagina, right? So for sexually active women, like every time they have intercourse, that is a possibility of introducing bacteria to that area. And then for, yeah, if it's very close to the anus too. So um, if someone has bad hygiene and wipe it the wrong way, so like get the bacteria or the dirty stuff to the opening, like that
Yeah.
can increase the risk of infection.
So what can
So
I do to
that's why
prevent
women, huh? What? Sorry.
it?
What
That,
what was the
yeah.
question?
No, that's super helpful info. I definitely know the wiping, especially as kids. It's like, are we really taught which direction to wipe in? I mean, it really is. It's maybe it's gross, but forward to back.
Yeah, that should become one of the things that parents need to tell their girls. And
Yeah,
even for boys, you need to do the other way too, like from front to back instead of back to front. Because when you get, you, you know, like feces can contain so many types of bacteria, especially E. coli. And E.
sure.
coli is the most common cause of UTI. Could be because of that, right? So it's very important to know. And for the parents out there, if you have little kids, you need to teach them how to wipe their bottom um, the right way from the beginning. Yeah. And then another thing is that, for women who get to the perimenopause or menopausal age, like our hormonal levels are fluctuating and changing, and that affects the bacterial and the uh, grow, the protective bacteria grow in that area to protect us too. So for menopause women, they may be at a higher risk of getting UTI as well. And then another risk factor could be comorbid conditions, means other chronic
Mm,
conditions that you have, like diabetes, um, like immunocompromised conditions. If you have HIV, um, or have autoimmune disease, you're using immunosuppressants, that may lower your immunity overall and make you at higher risk of getting UTI. So you need to pay attention to those symptoms, and have good hygiene, a good wiping habit, a cleaning habit. Um, and then if you're sexually active or have a lot of sex, you need to make sure your partner is clean as well, and then wash afterwards. Oh, when we talk about a wash, I want to mention another thing. Like there are a lot of products out there. They claim to be effective or help you reduce infection and things like that. So just be careful with that. All those commercial type of products, that anything that may kill a broad spectrum of bacteria may not be good for you to wash the bottom, because it can kill the good and the bad. So if it kills all the protective bacteria, it actually will put you at risk. So just soap and water
okay,
is good.
that's helpful. No, that's really helpful. So if I want to prevent a UTI, just based on the things that I've heard you say, it's, thinking through like, again, wiping front to back, not
Hmm.
holding in urine for long periods of time. So if you got to pee, go to the bathroom.
Yeah.
Uh, going, go to the bathroom after you have sex, and then drink plenty of water. It is so key.
Exactly. So the more you drink, the more you will urine. So flush out any bad bacteria there could be, right? So
Mhm.
yeah, don't hold it. For pee, for poo poo, don't try to hold it, because when you hold it, like you're messing up your own uh, rhythm.
Yeah, that's
Um,
helpful.
yeah, I know we talk a lot of the common risk factors for UTI, right? The first thing is the female anatomy. We're just built that way. And then sexual activity. So, yeah, more sex means more like
Or
high risk
risk.
of infection. So yeah, and then if you constantly change new partners, that can put you at unknown risk, not just for UTI. There could be other sexual disease as well,
Mhm.
and
Yeah,
hormonal change. When you go through menopause, you may be at higher risk. And yeah, bathroom habits. And then yeah, if you have other medical conditions, um, you have to pay a little bit more attention. And then another thing is catheter use. There is a catheter-induced infection in a lot of surgical patients. Like after they have surgery, they have to put a catheter in to help the pee come out. So that catheter can introduce infection as well. So if you have a surgical patient at home, um, that who has a catheter, so need to try everything you can to keep that clean and to prevent infection.
that's helpful. It sounds like a lot of these things are modifiable risk
Oh
factors. So I think that's the important thing to emphasize is that while, they can be very painful and cause a lot of discomfort, there are a number of different things that we as women, well, and men and women can do to prevent urinary tract infections. So this has been really helpful in kind of understanding, what are the risk factors, what are the reasons we get it, how common is a UTI, and thinking through some ways to prevent that risk, right?
yeah, and believe it or not, it's just so common. 50-60% of women will experience at least one episode of UTI in their lifetime. And every year, 20 to 30% of women experience at least one episode of UTI. And about a quarter of these patients may have complicated UTI, and that may lead to hospitalization.
Mm-hmm.
And it's also the most common cause of antibiotic use among women.
Mm, I believe that.
Yeah. So it's very common. And don't be shy to, talk about mention it. Like you do not need to, endure the pain all by yourself. Um, so notice symptoms early, and get treatment early, and
Yeah.
drink a lot. And then all the things we talked about before all apply. Anything, everything that can boost your immune system, make you stronger, that will lower your risk of getting the infection.
So how many of the UTIs are considered sort of everyday normal UTIs as opposed to sort of what we refer to as more complicated?
So it's a relative word, right? We call it uncomplicated UTIs, and most of the UTIs, like 80%, 75%, are uncomplicated.
Mhm.
That one course of antibiotics may solve the problem. You're all good. And then the complicated ones usually refer to uh, UTIs occur among women, among not just women, men too, who have who have underlying conditions like what I mentioned, diabetes or immunocompromised conditions. We also call, like, if a UTI led to a hospitalization, we call that a complicated UTI as well. Um, and it just interestingly, this past month, I got to know two cases of sepsis occurred that occurred in young people, like 20 something year old, and both were caused by UTI.
Oh
So
wow.
one was like one is a boy who had kidney stone, and the kidney stone caused infection in the kidney, and that led to sepsis. That is right. That is still infection in the urinary system, so it's still called UTI. Um, and then the other one is a silent. The doctor suspect that it was a silent UTI, means that there was not symptom, but the bacteria got in and went
Mm.
all the way up to the kidney, and then and that led to sepsis. And for people who don't know sepsis, the sepsis is one of the most common diagnoses among like hospitalized patients in the US, and then it
Mm-hmm.
can cause kidney failure and other organ failure. It means that the bacteria got into your blood and then it starts to multiplying in your blood, and that causes multiple organ failure. Um, and it has a very high risk of being in the ICU and then die. So that's definitely something that we don't want to get to, you know, if we have a choice.
Yeah, absolutely. That's so interesting. So it sounds like it is more common among women than men, though. Is that right?
Yeah, a lot more common.
Okay, that's helpful.
Continue
Um,
our anatomy.
oh, women, all the things we have to deal with.
And I guess that that boy's case bring up another point, right? If you have kidney stone, um, like you need to get that taken care of too, and then need to watch out for infection.
Yeah, I think that's helpful, especially because it's like something that maybe started as maybe not a mistake, but maybe an uh, like you said, you didn't pee after you had
Yeah,
sex, or maybe you wiped wrong, can turn into something so serious. So it is important that you pay attention. And then when you do start experiencing those symptoms, you go to the doctor and you tell the doctor, hey, this is what I'm experiencing. And then it is important once you do get those antibiotics to take the full course of treatment, right? So you don't develop, and I know you had mentioned this earlier, but you don't want to develop resistance to the antibiotics, right? And
yeah,
wondering if you want to touch a little bit about that.
that's something you don't want to. Yeah, we want to use antibiotics when we need to, when there is
Yeah,
an actual bacterial infection. On the
yep,
other hand, if it's a viral infection, like if you're getting a cold or getting another viral infection, you may not always need antibiotics. If you misuse it, you're more likely to develop resistance. And resistance at certain circumstances means if they could not find something to treat your resistant strain, like that can lead to sepsis or death. Like, and that's often seen in a hospital setting for people who get hospital acquired infections. That those usually are drug resistant because those bacteria has been multiplicating in a hospital setting from patient to patient. Those patients are usually like heavily treated. So yeah, like MRSA, like methicillin resistant staph aureus infection is that it's a big problem. Um, yeah, but for the case of UTI, if you have any UTI symptoms, go see a doctor. You need to get antibiotics right away.
great. Well,
Or if
thanks.
you want to be more cautious, you can do. I mean, most doctors don't really do culture in UTI setting because most of the times it's caused by the GI bacteria, usually E. coli.
Hmm, interesting. Well, thanks for sharing all that information. It sounds like there's quite a few preventative measures we can all take to prevent UTI and overall focus on improving our health. I think the main takeaways I would say is that women, we're at greater risk because of our anatomy.
Yeah, drink lots of water and have
Yes.
good hygiene and wipe from front to to back, and do everything that you can to boost your immune system, um, and stay healthy. And then if you notice and know about the symptoms, right? If you feel any of the symptoms we talk about, go see a doctor and get treated right away and finish the full course
Yep, exactly. Finish the full course and
of treatment.
yep, yep, exactly. So, well,
Yeah.
thank you all for joining us today. And we are looking forward to, well, not maybe not looking forward, but we would be interested in hearing if you've, experienced a UTI and Hopefully, these tips help you. Please drop your comments and your thoughts in the text below.
Yeah, and we hope you can help spread the words, help educate other people as well. Um, Share this episode if you have a friend who is constantly having the problem,
Yep.
um, and educate your kids the right way to prevent it. So we hope everybody stay healthy. We hope like we can work together to lower the prevalence.
And make you healthier, which is the most important thing.
Exactly.
Yeah.
Yeah. Have a happy Lady Vibe Tuesday, everybody.
Happy Lady Vibe Tuesday.
Thank you. Bye bye.
Have a great day.